we have been getting few cases for urinary block in cats. So I wanted to discuss about this case. Like, when is the time when owner should notice that their cat might be having urinary block?
Well, two things that owners should know about urinary block is that it's very common in male cats,
Okay.
more common than female cats. Second, it is commonly seen in cats who have been kept exclusively on dry food.
Okay.
And thirdly, it is a sign which may get overlooked by the pet parent. So often it begins with a difficulty of passing urine, and the cat may not pass urine for a very long time, and the pet parent may not notice the symptom for 1 or 2 days, even 3 days, until the cat starts puking and showing symptoms of urinary retention. So it's always important to see that if your cat is passing urine or not.
How many days they can postpone it? Okay, if 1, 2, or 3 days, till when it is considered as an emergency, okay, we have to rush to the veterinarian.
Urinary retention for 24 hours or more is always an emergency.
Okay, so if your cat hasn't passed urine for last 24 hours, then you should seek a veterinarian.
Yes, always, always.
Okay.
And usually the cause of it is something that blocks the passage of the urine.
Okay.
So most of the time it is calculi or stones. So these stones may be formed in the kidney, pass into the bladder and eventually into the urethra, or they may form in the bladder and pass into the urethra. Either way, it can block the passage of urine and cause a urinary block.
Okay, so what can induce like the diets or the regular activities or how the pet is kept inside home? So is there any precaution that owner should take so this condition is not happening in their pets?
So primarily the diet is involved. Some cats are predisposed genetically, but then the diet is also important for development of stones. Cats who have been kept on solely on dry food, as I said before, they have a higher predisposition to formation of stones and urinary blocks. So it's always best to revise what you're feeding your cat, and it's important to maintain a proper ratio of wet to dry food. If you are giving more dry food to your cat, that can cause a higher possibility of stones. But we always suggest pet parents to give a greater proportion of wet food over dry food. So the ratio should always be maintained at 4:1, wet to dry.
Okay.
And that's how you can ensure that your cat doesn't have a risk of developing urinary blocks.
Okay, so once the cat develops it, so what can be the next step that they should go for?
Well, as I said, that it's an emergency when the urinary passage gets blocked. So the veterinarian usually uses a catheter. The catheter is passed through the urinary tract and the block is relieved. Now it can be done under general anesthesia or local anesthesia, depending on the risk involved.
Okay. So this catheter is permanent treatment or?
Recurrence is quite common. So once we relieve the block, we cannot surely say that it won't recur again. So once your cat is predisposed to it, then your cat may develop it again in the future. So we usually suggest dietary changes. So there are special diets meant for urinary blocked cats or cats that have stones. So we suggest pet parents to start their cat on those diets.
And regular checkups are needed even after the urine.
Of course, and some medications.
Okay, for how many days they should continue the?
They will be for a prolonged period of time until the risk involved is completely eliminated.
And is there any precaution that owner should take so that it should not happen in their cats?
Well, the same thing. Dietary management is prime, and keeping a watch on the cat's activities, the routine activities, namely the urination, defecation, and appetite. So these are the 3 checkpoints where you get clues as to whether your cat is ill or healthy.
Okay, so is there something you wanna add in this?
I think I summed it up pretty well. So
okay, thank you so much, sir, for
most
the information.
Thank you.